Now, guys, today topic is ascites. What is ascites? Excessive fluid accumulation in peritoneal cavity called ascites. Cause first is cirrhosis with portal hypertension. It causes increased hydrostatic pressure, and second decrease oncotic pressure. Right. Cardiac failure like CCF, renal failure, hypoproteinemia, intra-abdominal malignancy, right, pancreatitis, TB, one of the most common cause of ascites, right, one of the most common cause of ascites, hepatic occlusions, rare syndrome like Mack syndrome, lymphatic obstructions, vasculitis, and hypothyroidism, and pathogenesis, retention of sodium and water, cirrhosis of liver, cirrhosis of liver, it causes retention of accumulation of nitric oxide, cause splenic and peripheral of atrial dilation, right, decrease blood volume, right, sensed by kidney, activate renin angiotensin system, and with secondary hyperaldosteronism, increase sympathetic activity, atrial natriuretic hormone on secrete. All this change lead to water and salt retention. It increase hydrostatic pressure in portal venous, splenic vasodilation, increase portal hypertension, combine splenic vasodilation and, and increase portal hypertension, increase hydrostatic pressure, leading to oozing of blood out from capillary to peritoneum cavity. Right. And next is hypoalbuminemia. It decrease serum albumin in cirrhosis, decrease oncotic pressure, excess accumulation of fluid in peritoneal cavity. It causes ascites. Right. Feature. First symptom, abdominal distension. Right. Abdominal distension. Dyspnea and orthopnea due to push up diaphragm. Right. Epigastric and retrosternal burning sensation. Epigastric or retrosternal burning sensation due to GERD. Okay. Low grade fever, weight loss, suggests TB etiology, presence of exertional dyspnea and orthopnea, and PND. It suggests heart failure, right? Heart failure. And sign: at least 1 liter of water should be clinically present to be diagnosed. And jaundice is present, dilated abdominal vein over abdomen due to portal hypertension, diffuse abdominal with fullness of flank, umbilical is flesh with skin or everted, shifting dullness positive on percussion, and horseshoe dullness positive on supine position. Okay, poodle sign. What is poodle sign? In poodle sign, detect even a minimal ascites, 120 ml of fluid. Patient in prone position, 5 minutes, and then put in knee and elbow position. Diaphragm is put Diaphragm of sthetto is put over dependent part of abdomen, right? Dependent part of abdomen. Percussion note indicate fluid. ठीक है. Tenderness in abdomen, more common in TB and peritonitis. Okay. Hernia, abdominal striae, and scrotum edema may be present, right? Malignance in malignant ascites, sometimes mass may be palpable per abdomen. Okay. Investigation: ultrasound, USG, to detect ascites in case of liver cirrhosis and intra-abdominal malignancies, portal hypertension, etc. Ascites fluid analysis करेंगे, right? First we saw straw color or fluid, transdude, right? Turbidity in infection and malignancy, white color in chylous ascites, right? A dark brown biliary tract infection. Okay. Black fluid, pancreatic necrosis or metastatic melanoma, right? Serum ascites albumin ingredient, SARG. It is the best test to classify ascites. SARG if more than 1.1 transduced, SARG if more than 1.1 we call a transidative. If less than 1.1, we call exudative, right? Total protein in higher more than 2.5, more than 2.5, right? Exudative ascites, okay. Elevated sarge, and high protein level as, as occur ascites due to hepatic congestion, right? Low sarge, and high protein. We call malignant ascites. Then we do culture, gram stain, and acid fast for TB, and other bacteria. Right. Malignant cytology. Suspect malignant ascites. Ascitic fluid amylase. If more than 1000 mg per deciliter in ascitic fluid amylase. Pancreatic ascites, right? If more than 1000, in pancreatic ascites. ADA, adenosine deaminase, more than 40 unit per liter is in TB ascites. X-ray rule out pleural effusion, cardiomegaly, and CT scan rule out ascites, TB, and malignancy, etc. ECG. In ECG, rule out conjunctive cardiac failure. Right. Treatment to treat underlying cause, diuretic to reduce acidic fluid with portal hypertension. We also use ironolactone and furosemide. Right. Sodium and water restrictions. Paracentesis for diagnosis as well as treatment. Okay. Tips. Transjugular intrahepatic portosystematic shunt we do. Right. Okay. Thank you for watching my lecture.